If a child or young adult presents with symptoms of osteochondritis dissecans, then we have to have a detailed examination of the knee joint as well. And there are certain things which we must rule out because we have to have certain differentials as well in our mind. The first and foremost on the physical examination is, most of the time you can probably see some form of a swelling over there. There may be tenderness as well. Tenderness could be generalized or it could be at a certain point, as mostly if it's the localized tenderness, that will be present around the medial side or medial femoral condyle, because the most commonly involved area is the posterior lateral aspect of the medial femoral condyle. If there is generalized tenderness over there, then it could be stiffness. When the mechanical symptoms are coming, this may lead to stiffness because usually knee is swelled up and there may be problem for the patient to actually flex and extend the knee joint, and the arc of motion may be reduced slightly as well. So one has to inspect, palpate, and then eventually move the knee joint as well to assess it completely. Others could be swelling, which could be very well seen right from the inspection. There may be effusions. Now, effusion could be generalized or it could be in the certain area, for example over the superior medial aspect of the patella or over the medial femoral condyle. This is where the most problem is, therefore mostly the swelling is around this area. And then last is the Wilson test. We do not only do Wilson test, we also have to have certain differentials in our mind as well. For example, a patient can have meniscal injury if he's young adult. If it's a child, let's say of 8 or 9 years of age, then this could be even the problem is on the lateral side. This could be lateral discoid meniscus as well. So we have to perform other tests such as McMurray test as well, and other look at the knee as a whole. But for specifically the test which is present for the osteochondritis dissecans is actually the Wilson test. And what is this Wilson test is actually that you internal and external rotate tibia at different angles. You internally rotate tibia at first at the 90 degree, that is in complete flexion, and then from you move up to 30 degree of flexion. Once if it's going from 90 to 30 and the patient is actually feeling pain, this means most likely the Wilson test is positive. And from then you externally rotate tibia in 30 degree and you bring it back to 90 degree of flexion. With external rotation, the pain actually goes away. Why? Because the mostly involvement is of the posterior lateral aspect of the medial femoral condyle. Therefore, when we are internally rotating, the maximum stress is actually on the posterior lateral aspect of the medial femoral condyle. But when we externally rotate tibia, the forces are being transmitted towards the posterior medial aspect of the lateral femoral condyle. Therefore, that area is normal. Therefore, the patient becomes pain-free. And this is when, if the Wilson test is coming out positive, one must suspect osteochondritis dissecans and should be thinking on other differences as well. But usually with the Wilson test, it points to only one disorder, that is the osteochondritis dissecans, and other differentials like meniscal injury, discoid meniscus, medial plica syndrome, all these can be actually safely ruled out. Although we need to, after detailed history and examination, we need to have all these differentials in our mind, and we need to go for further investigations to refute our other differentials or to confirm our diagnosis. But whenever we are doing the physical examination in osteochondritis dissecans, localized tenderness, stiffness, swelling, and Wilson test is usually positive.